Welcome to Body Best Doctors. Today we're going to talk about the occipit, which is the base of the skull, and that's where the skull attaches to the actual neck. So we're going to check this bone here. What happens in accidents, injuries, traumas, stomach sleeping, whatever stresses the neck, the head goes always off to the right, this side of the equator. The head always goes off to the left on the other side of the equator. So wherever you are in the world, the doctor and the patient is going to be different due to the spin of the electromagnetic field. And then when we get injured, we go into that field and we're stressed, and then the doctor can reset it. So we're going to show you how you reset the occipit. So it sits right on top of what we call the atlas vertebrae, C1. There's no disc, and it's quite movable. So how we test it, have the patient lay face up. I use my 3 fingers here and I come under the base of the skull, and so these ring fingers are touching the base of the skull. And you can see these 2 fingers are pretty much balanced. So this patient has her head on straight. That's a joke. So keep your head on straight. So what we have, now come back and I'll show you. Now, if it just tip it slightly, if her head's off balance, now look at the fingers on the right side is lower and left side is higher. So that's a forced misalignment, but that's showing you what we generally find on most patients. Once that's found, then we have to set it back in place. Now we're going to actually make a correction of an occipit, the top of the head, and it works together with the sacrum. So in the example here, our little orange tailbone and our white head literally pump flexion and extension, pumping the cerebrospinal fluid around the brain and spinal cord, just like the heart pumps blood around our body. And when we get in accidents or injuries or trauma or stress ourselves, it gets the head and the hips off balance. We start having headaches, we can have nausea because it affects the diaphragm, and the list goes on. So it's a very important area to check. So we check the leg length. The left leg on this patient is slightly shorter. So we'll take the block, slide it low, and we'll get the legs balanced. Raise your hip up, down, right hip up, and down. The blocks are placed on an oblique, not straight across. So then we come back and recheck the heels to make sure I put the blocks in, and now you can see that the heels are now balanced. They're the same. So we know we've got the blocks in the right place. So what the blocks do is taking the stress off the strongest joint in the 2 joints in the body is the sacral iliac joints, where the ilium, our 2 hip bones, come in attached to the sacrum. So I put the blocks in here at an angle and open those joints up so the sacrum can release as I release the occipit. So this patient, for the film, we're pretending that it was off on the right, so I'd have her turn her head to the left. Turn the head to the left. Then we would take the instrument, which I'm not going to do. We take the instrument, and since I have a double-headed activator, it's called, and we put it underneath the base of the skull, my fingers, and then I put my fingers, the instrument right on my fingers, and then I set it 3 times on inspiration. So I'd actually make an adjustment. I'd say breathe in, I adjust it again, breathe out, and adjust it the 3rd time. That unlocks the whole cerebrospinal fluid and the head and the sacrum simultaneously. And again, we usually find the patient out of balance on the scales, if they were, and then after the correction, we make sure that I can test it myself to see if it's corrected. Then I have the patient go onto the scales, the digital postural analyzer, and see if they're within perfect balance within 5 pounds. Welcome to Body Best Doctors. Today we're going to show how an occipit, base of the skull, gets out of balance and how we set it by hand. This is the occipit, sits on top of the first vertebrae, the little purple one here, the atlas, and generally it usually goes off to the right. So I check it by just coming under the base of the skull, and I can see my fingers, and we can see that it's off to the right. Hers is balanced, but most people is off to the right. Now we're going to adjust it by hand. We're going to have the patient lay face down, forehead right here, breathing hole. Now, the sacrum, the tailbone, and the occipit, base of the skull, there's the skull, there's the sacrum, they pump the cerebrospinal fluid around the brain and spinal cord like that. So, to correct it, we put blocks in at a certain angle to release the sacrum, and then I'll show you how we set the head by hand. So we look to see which leg might be slightly different. Her right side. Hands can just go comfortably off the table. So then we can put the block low here, and this block or wedge here high, so it's untorquing her sacrum, and now it's balanced. So we get to release the sacrum with the blocks, and then we release the occipit by hand. It always goes off to the right, so we always have the patient turn to the right. Go ahead and turn your head to the right. Then you have your forearm. Raise your head up just a little bit. I'm going to slide my forearm underneath the chin all the way down. Then I just take my other hand and take my forearm, put it just comfortably behind the ear, and then I just usually touch the chin so I got somewhere else to put my hand. And then we have them take a big deep breath. I'm not going to do it, but I'll just show it. Let it all out, and then you put a little pressure on your forearm to open up the joint on the head, and then you just quickly, a little bit of adjustment for the chiropractors to adjust it, and it puts it right back in balance, and it usually makes a little click. Then we're going to take the blocks out. I'll have the patient roll over onto her back. And then again, we can check it to make sure it's corrected. I take my ring fingers again, slide them up under the base of the skull, and her head now is perfect. When it's off, it goes high on the right, or excuse me, low on the right, high on the left. So that's how you set it, how you correct it, and how you then make sure that it's perfect. And it changes their life. They sleep good, they feel good, they're happy, their serotonin comes on, the melatonin comes on. It's amazing what a difference it makes, and people make the statement almost every time when they stand up, "Oh my gosh, I feel better already." It's instant.